We're going to go now to Governor Ron DeSantis, who is speaking in Fort Lauderdale about the coronavirus.
Good trial run for what will likely be a busy hurricane season. In particular, we had the opportunity to beta test the new sheltering strategy, which we had to evolve in light of the coronavirus. The state of Florida sent PPE kits and thermometers to all shelters in the storm's path and arranged for non-congregate sheltering options for people who either had or were suspected of having COVID-19, and it all proved to be very helpful. In Palm Beach, for example, we had people show up to a shelter that had tested positive recently or who did not pass the temperature screening, and those people were redirected to a nearby hotel where they had a safe place to stay until the storm passed. And I would just tell Floridians there's been a lot of activity up to this point in the season. We do anticipate more storms developing, so make sure that you have a plan. Hopefully, we'll hope for the best on this, but we absolutely need to be prepared for more storms. I'm really glad to be here with Broward Health. We have Gino Santorio, the president CEO. We have Josh Lenchis, doctor, chief medical officer, Cheryl Wild, chief nursing officer, and Dave Lacknuth, executive director, pharmacy services for Broward Health. They're going to talk about some of the things that we've been working on in conjunction with them. I think that they've done a really good job. I think everyone throughout South Florida has done a fantastic job, frontline healthcare workers and the hospitals in responding to this crisis. We are looking at I'm going to make an announcement today about testing, which I think will be helpful, but we are encouraged by some of the trends we're seeing. We continue to see a downward trend in visits to the emergency department with people with COVID-like illnesses. We've seen a peak in COVID-positive patients that are hospitalized statewide happened the third week of July. We've continued to see that census decline, and I think that is consistent with what they've seen here at Broward Health. Today, we reported one of the lowest numbers of positive tests that we've reported in a long time, and we've had 2 days in a row where the positivity has been 9%, which we were 15, 16% there for a while. So, these are encouraging trends. Obviously, there's a lot of more work to do, and one of the reasons why we're here today is because we want to address the remaining challenges. One is the turnaround time for testing. When we started going to expand testing in May, we thought that if we could get up to 35,000 tests a day, that would really, really be doing well. Remember, in March and April, we were doing 7,000, 8,000, 10,000 tests a day. There obviously was a need for more capacity, so we worked to do that. We have done a lot more than just 35,000. We typically will get in roughly 100,000 test results in a given day. You're also seeing more and more testing throughout the country. The result of that has been turnaround times at a lot of the commercial labs have just been moved to the right more and more. You have longer wait times. Obviously, if you're somebody that is symptomatic and you don't get your results back for 7 days, that is not helpful. For our asymptomatic test takers, if it takes 7 days, then the test is basically useless at that time, because even if you were infectious at the minute you tested, by the time you get it back, you probably haven't been isolating anyways, and you're likely to not be infectious on the back end of that. And so increasing the times is something that we're looking to. So, I asked Jared Moskowitz to make some changes to try to do that. So starting tomorrow, we're going to have some real positive changes. We're actually going to convert 2 of our sites in Miami-Dade County, the Marlins Stadium and Hard Rock Stadium, to exclusively 15-minute antigen tests. The tests will be for people that have symptoms or for elderly 65 and older. There'll still be a lane for the traditional testing for the other asymptomatic people, but that'll be the traditional swab with the traditional lab. But for those folks who are older or who are symptomatic or both, you're going to be able to go in, get the antigen test, and in 15 minutes walk out with a result. That's not only good for the test taker and the patient, it's also good for officials monitoring the trends. When we get tests reported to the state, sometimes those tests were taken 10, 14 days before. Certainly the infections in many cases happen 10 to 14 days before. So if you're looking at things like the positivity rate or some of these other things, a lot of times that data can be stale. Now we're going to get every day at these two sites, total of 1,250 tests. We're going to be able to get real-time data about the percent testing positive, the number of people testing. And so I think it'll be really, really good. People want to know and want those results back. Every other drive-through site throughout the state of Florida, we are going to have symptomatic lanes. This will be people that are experiencing coronavirus symptoms or 65 or plus or both, and they will be able to self-swab. So they self-swab. We have relationships with certain labs that once we get them the swabs, we usually get a 24-hour turnaround from the time the lab receives it. So if we can get it to them as quick as possible, they typically turn it around well. This will be, I think, very good. So it's not going to be 7 days, which is what's been happening. So hopefully it'll be, more of a 48 to 72-hour window, which I think is a big deal when you're talking about this. And of course, there will be a lane for people who are asymptomatic. We're also going to offer at all these sites antibody testing. And it's something to think about because I think we've seen with more of the research and the data that's come out, particularly over the last few weeks, CDC has now moved to a symptoms-based approach for employees going back to work. They're discouraging needing to get a negative PCR test. And I think part of the reason that the antibody test may make sense for people that don't have symptoms is PCR tests can pick up dead virus. CDC says up to 12 weeks, but certainly we know people, who have tested positive for days and days beyond the 14-day period. That's not an uncommon thing. So if you're asymptomatic and you're testing, we really can't tell you for sure whether you have live virus, once we get those results. Now, some people still may want to do PCR. It's going to be there, but the antibody test, will be able to tell you whether you have the antibodies and whether you have been infected. And if you have IgM antibodies, then you likely had a more recent infection. If you have IgG antibodies, likely were infected a little bit further back in the past. So that's very valuable information for people to know whether they have the antibodies. And what we've seen is since we opened up antibody testing to the general public, we used to do it for the healthcare workers and for the first responders. We've opened it up. We've seen the antibody rates increase throughout Florida. And some days we'll test 15, 16, 17% of the test takers will be positive for antibodies. Now, it's not scientifically representative because it's just first come, first serve. But I think that there's a surprising amount of antibodies out there. So if folks want to do that, we're going to be able to do it. But it's all about lab prioritization, understanding that there's a limited lab capacity for a quick turnaround. And if we can focus on those people who really need the test results the quickest, I think we're going to be able to improve. So you're going to have 2 sites with instant tests, and then you're going to have the other drive-through sites with the self-swab and quicker turnaround at the lab option, which I'm really excited about. We're also working very closely with all the hospitals throughout the state of Florida as we look down with this coronavirus crisis. The 2 things that I think were just so important to get right were doing everything we could to protect the vulnerable, particularly those in long-term care facilities, but then be there to support our frontline healthcare workers and our hospital systems. Remember, when we did the whole flatten the curve in March and April, that was all just to buy time to be able to make sure that the hospital system could cope with the pandemic. And we've worked really hard with all the hospitals. As they've had needs, we've worked really hard to respond with any assistance we can buy. So, for example, with this remdesivir, which is one of the top therapeutics that doctors are now offering, we've gotten 3,500 cases delivered to the state of Florida, which is 143,000 vials. And as hospitals ran low, we had to go to the White House and get the schedule expedited and be able to get more remdesivir in the hands of our frontline physicians. And I think Broward Health, they were going low, and then they got replenished before they ran out, and that's what we were trying to do. We're also promoting convalescent plasma donations. Hospitals do need this. It's high demand. It can be an effective treatment, and so we're going to continue to encourage people throughout the state of Florida to give blood if you do have the antibodies, if you've recovered from an infection, to go give the blood. That's one of the reasons having the antibody lanes at these test sites are good, because if you do test positive, you can go give blood and you can help potentially save a life. It's very, very important. We're also helping hospitals with personnel. When the pandemic really got hot and heavy in March, the fear that was put out was about running out of hospital beds. That never was really a threat in the state of Florida in March, April, May. But then as we got into and started seeing the prevalence increase, admissions, we reached out to hospitals and said, okay, what do you need? How's your bed capacity? And actually, to a man, they all said the bed capacity is great. We just need to make sure we have enough personnel to staff the beds that we have. And sure enough, that's been the case. We've had bed capacity the whole time. Certain areas of the state, because of the increased admissions, those frontline workers worked extremely, extremely hard, particularly in Dade and Broward. And so we were able to send 1,900 medical personnel to hospitals. We have more at my direction that can be deployed. 150 of the personnel are working right here at Broward Health. So these are personnel that we didn't necessarily use in March and April, May, and the beginning of June, but we had the arrangements in place so that if we needed to do it, we could do it. And I think that that's been a huge, huge source of help. I mean, you're
listening to Governor Ron DeSantis giving a news conference from Fort Lauderdale this afternoon. If you want to continue to listen to him speak, you can do so right now on our 10 Tampa Bay app and on our 10 Tampa Bay Facebook page. Real quick, we just want to let you know that he said starting tomorrow, there will be 2 sites converted in Broward County to exclusive 15-minute antigen tests. There will be lines for those who are 65 and older and also those with symptoms. And then there will be a traditional line where people can still go if you're asymptomatic, and you will get that in the traditional way. It won't be that 15-minute comeback with those results. He said that really the labs are taking a lot longer than they would like, and they want to see those results come back a lot quicker. He also mentioned that starting tomorrow, every day there will be 2 sites with the drive-through sites across the state for symptomatic lanes that can self-swab. So then they're also able to get those to the labs quicker, and saying that those labs would be able to turn them around in 24 hours from the time the lab receives it. So that would break that down to about 48 to 72 hour window. Again, you can keep watching that right now on our 10 Tampa Bay app.